Dr. Kristin Oha is a nurse practitioner, entrepreneur, and founder of Stat Wellness, specializing in personalized medicine and holistic health. With over 10 years of experience, she integrates functional and lifestyle medicine to uncover root causes of chronic illnesses, promoting overall wellness through unique treatment plans. A big OSIT welcome to Dr. Kristin Oha.
Hello. I am so happy to be here with you guys, and this is a great segue from the talk we just finished up. I have to tell you how excited I am to hear a dermatologist use the word microbiome, because it is critical to our healing and our immune system, which we're going to talk about. So let me make sure my little clicker works. Let's see. Do I just hit this? Okay. So I just wanted to quickly tell you who I am and why I'm up here. So I was a personal trainer first, then went to become a nurse with my bachelor's, then returned for my master's and finally my doctorate, and did training through the Institute of Functional Medicine and A4M. And one of the things when I work with my patients as a nurse practitioner is I always wanted to understand the why, right? Even on a simple place. So if my patient had high blood pressure, why do we have high blood pressure, right? If my patient had insomnia, why do we have insomnia? My mind always wanted to understand the why, and that's what led me to functional medicine. And I always talk about how functional medicine has a stigma of being very expensive and lots of supplements and tons of testing. And we do use some of those tools, but it's really lifestyle and pathophysiology heavy. How does our body work? Why does it work the way it works, right? Where are there some imbalances? How can we optimize our health? And so my goal today is to come and talk about comorbidities and to talk about how our body works as a whole and to talk about some things we can do to help with healing in general, taking a functional medicine approach. So I'm so happy to be here with you. My dissertation was all in the gut, so I really love the gut. We'll be talking about the gut a lot today. And hopefully you guys will feel very hopeful in some of the things we can do and feel empowered, which is our goal. And then I also have a 3-year-old and a 2-year-old. I say I never like to be identified by my work. And Stat Wellness, my company, has 3 locations now and about 7,000 patients. So we have treated a lot of people through functional medicine, and a large subset of people we work with is inflammatory conditions. We work with a lot of women, and as I mentioned, with autoimmune, 75% of people with autoimmune are women. And I always tell people women are not tiny men, right? We're very different. Chemically, we're very different, and hormones do play a role in our healing, our immune regulation. So, what are we going to talk about? Comorbidities, we're going to cover those. We're going to talk about some root causes, and most importantly, we're going to talk about what are some things we can do about it. I think that's what is most important. Like, we can talk all day about the comorbidities, but that can just feel very heavy, right? Now we're labeling ourselves with another diagnosis and another diagnosis. So at STAT, we like to move away from diagnosis, and we like to talk about big picture issues. And so the ones that I see the most affected when it comes to comorbidities, diabetes, as people mentioned, PCOS, for sure, we see this a ton, metabolic disease, depression, and inflammatory bowel disease. And these 4 things, they may seem like they have nothing in common, but they actually have a lot in common. And we bring it down to 3 things that we really want to focus on, that we're going to focus on today as a group. So number 1, inflammation. I always talk about how inflammation does not discriminate. So when we have chronic inflammatory conditions, it is never just going to affect the one area, right? It might not lead to another diagnosis, but it's going to cause things like fatigue, maybe some stiffness in the morning, maybe some depression, maybe some changes in our bowels. So it's very rarely that you're going to have inflammation in just one space when you're dealing with a chronic inflammatory response, right? It's got systemic involvement. The other one that we talk about a ton is blood sugar balance. This is one of my key components to longevity. If we can balance our blood sugar, it can help drastically with our healing and inflammation. Our body doesn't like to walk around with super high blood sugar and actually super low blood sugar. Hypoglycemia can increase cortisol, which is our stress hormone. And that can increase inflammation. So we really don't want to be low, under eating, not eating at all, and we also don't want to be high with glucose. So we're going to talk about that more. And then the other piece, which again, so happy we talked about the gut microbiome, is the digestive tract. And you guys might know this, but Hippocrates said over 2,000 years ago that all disease begins in the gut. And somehow, over the process, we've really become very siloed when it comes to medicine, right? Many of you in the room probably have an endocrinologist, a gastroenterologist, a dermatologist, a primary care, and they're all looking at their zones, right? And I love that because they become specialists. They become people that we need on our team, right? But we also have to take a step back and we have to look at how is this all connected together? How is our gut connected to our mood, right? We now know for sure our gut and our brain is connected through the vagus nerve, right? We've got the longest nerve in our body that connects the two. So if you guys have ever had the gut feeling or butterflies in your stomach, it's a real connection, right? And we think about 80 to 90% of our serotonin is made in our gut, which is our happy neurotransmitter. So if we're walking around with inflammatory bowel disease or maybe irritable bowel syndrome, an imbalance in our gut microbiome, maybe we have a weakened barrier, which we're going to talk about, it can impact inflammation systemically, but it can also impact our mood. And there's a lot we can do with our gut. As I said before, food should be used as medicine, right? Not by itself. We're not saying that we're going to cure anything or heal anything, but we're working on figuring out how our body is going to feel the best and work the best. And nutrition and lifestyle is so tough in science because we are all unique and different. So I work with, again, a lot of patients, and I don't recommend a one-size-fits-all diet. It's very personalized. It's very customized. And that makes it very challenging when you're trying to navigate it on your own, right? So we're going to cover these 3 things today. So inflammation. We look at inflammation as a whole. Sorry, my slides got off a little bit on the screen. But we look at inflammation as a whole. And so what are some things that contribute to inflammation? Now, there are so many, and they're very unique for every single one of us in this room, but some general things. Vitamin D deficiencies. We see vitamin D deficiencies with autoimmune all the time. Vitamin D is a very important, it's actually a hormone in the body that helps with our immune and inflammatory cascade. So I want you to have someone on your team that's willing to check a vitamin D. It's a very basic level that we want to make sure is optimal. We also talk about lack of sleep. So sleep is when our body recovers. So if we are not sleeping, or if we're not getting good quality sleep, it's going to impact our inflammatory cascade, our immune system, our ability to heal and recover. We also talk a lot about stress. Stress is a huge driver of inflammation. This is where you'll see people when they're super stressed get sick, right? They're like, man, I keep getting sick over and over again. These are connections that a lot of you in the room have probably felt. Maybe you flared after something traumatic happened or a season of work that was really stressful, right? We know stress is connected. We also talk about infections. So this is, of course, something we saw a lot since 2020. We started to see the role of viruses in inflammatory conditions. So we've seen a lot of people develop Hashimoto's or other conditions post viruses like COVID, but there's many other viruses. So when our body is fighting infection, it increases inflammation, and we want that response, right? We don't want to walk around with low-grade infection. We want an effective immune system. We talk a lot in our world about leaky gut, and you guys might have heard of this. It's truly an increased intestinal permeability. There is scientific research that now looks at this connection, and how does that impact our systemic inflammatory markers. So we're going to talk about that. We, in our culture, use a lot of added sugar and a lot of processed oils. And for almost everybody, these are inflammatory, right? In our world, I know this is a bit extreme of a statement, but we laugh and say that sugar is the devil's dandruff. It just fuels inflammation for a lot of people, this white processed sugar. It doesn't mean we can't ever have it, right? I always tell my patients, you might see me on a Friday night eating a burger, right? We want to live in a space of balance, but the more we're putting in things that help reduce inflammation, the better for our body, right? And then use some of these things as special occasions or, here and there, not an everyday, every meal, because our culture wants to give us sugar with every single meal and inflammatory oils and processed foods and ingredients that we don't even know what's on the ingredient list, right? And this does not have to be expensive and fancy. We're going to talk about some really simple things. We also at STAT love to check omega-3 fatty acid levels. So we look at these through LabCorp to see omega-3s versus 6s. In our culture in the United States, we have a ton of omega-6s and very low omega-3s, where if you look at a Mediterranean-style diet, they have a lot more omega-3s than omega-6s. So we actually check these levels on our patients so we don't have to just guess. Okay, we see that you're getting a little too much omega-6s, not enough omega-3s. How can we tweak this through food? And then we do look at food sensitivities. A lot of people think with food sensitivities, you have to do a super expensive test through a functional medicine provider, and you can run these through LabCorp. So if you have a relationship with your primary care and maybe you're interested in some of the common ones, you can check gluten, you can check whey, you can check eggs, soy through LabCorp. And I always like to talk about food sensitivities versus food allergies. So maybe you guys have heard about the difference between these, but they are very different, and food sensitivities are very controversial. And so I'm going to share our experience in functional medicine when it comes to food sensitivities. So IgE is an allergy response. If you are allergic to a food and you eat it and your lips start to swell and you're coughing and you're breaking out in hives, nobody is going to disagree that you're allergic to that food, right? Like, please don't eat that food. It's life-threatening. Food sensitivities are never life-threatening, and they're never going to cause an anaphylactic reaction. They're never going to cause your throat to swell, your lips to swell. Food sensitivities are an IgG reaction, and IgG reactions are delayed immune responses. And the reason we care about this so much, let's say, for example, you have a dairy sensitivity. Does it mean for the rest of your life you can never eat dairy? No, but what if you're eating dairy for breakfast, lunch, and dinner every day, and you're just slowly activating your immune response? You're triggering that inflammatory response. It's a gradual process, and the half-life is 23 days for these IgG responses. So let's say you cut out a food for 6 weeks, and you feel so much better, and you're like, I want to recheck my levels through LabCorp. So you go to your primary, and you're like, hey, I've cut out dairy, I feel so much better. Can we see if my sensitivity is gone? It should be lower, right? Because our antibodies go down based on exposure, different than an allergy. So then we consume the food again, and we see how's our response to that food. Sometimes with food sensitivities, we can eat the food in moderation and not be too inflamed. Other times, we eat the food one time, and we feel bad. And we're like, why eat the food, right? If I feel bad, why do it? And so we help navigate that because we don't have the thought process that everybody needs to cut out gluten and dairy and sugar and soy and all of these things at 100%. But if you do have a severe dairy sensitivity, we see this correlated to cystic acne. So when our patients take out dairy, we see their acne improve if they have a sensitivity, right? And so if we can help through food by getting a more individualized approach and see how your immune system's responding, we don't have to guess. We don't have to be on this trial of cutting things out forever, if that makes sense. So those are some of the big things that we see correlated. There's tons of things when it comes to inflammation, but these are some of the key ones. And we talk about very inexpensive tests, again, through LabCorp, of how to measure inflammation. My 3 very cheap, easy tests is a C-reactive protein, sed rate, and a white blood cell. And so, again, talking to your primary care and asking them, hey, are you willing to run these and monitor them? Because I work with a lot of people that no one has ever checked their CRP. Or maybe they're 33, and people are like, well, you don't have any risk factors right now, and we check their CRP, and it's 18, right? We want a CRP less than 1. We really don't want any C-reactive protein in our body unless we're fighting an infection. If you are actively sick, and I do your blood work, I hope your CRP is high, right? That means your body is doing what it's supposed to do. It's activating its immune and inflammatory cells, and it's helping to fight infection. So it's really important for us when you're feeling well and at a baseline, what is your CRP? We have normalized what a normal CRP level is. And so I don't know if you guys have ever heard how reference ranges came about in labs. But what they did was they took a sample of people and they put them on a bell curve. And they make this 2% abnormal and this 2% abnormal. And that's our range that we're given on LabCorp, right? So when I first started practicing functional medicine 12 years ago, 11 years ago, our range for CRP was 0 to 5. That was our range. Slowly over the years, LabCorp now our range is 0 to 10. So we're normalizing CRP. So if you're at 9, you're within the normal range, but that's inflammation, right? And so let's say you get your primary care to run a CRP and your CRP is at 4 and they're like, you're really fine, like you're within the normal range. That is some low-grade inflammation that's gonna impact your healing and recovery. So what are some things we can do through our lifestyle to decrease the CRP? And through medicine, right? Like this is where a lot of times people will get on biologics and be able to control their CRP. We do use GLPs, and we've seen people's CRP. I have one patient that her CRP went from 25 to less than 1 after a year of being on GLP-1s. So it doesn't mean, of course, that's for everybody, but clinically I've definitely seen improvements in inflammation specifically when it comes to these. So what do I talk about? When we talk about inflammation, I want to be as broad as possible because we're all very different. But I focus on when we think of inflammation as a whole, if we're eating simple ingredient foods, our body recognizes those. It likes it, right? So let's take the complication out of nutrition and ask ourselves, how many times am I eating a single ingredient food? Broccoli, carrots, rice, chicken, quinoa, black beans, avocado, olives, salmon, right? These are single ingredient foods that our body likes for the most part. And we can get into food sensitivities, of course. But I will tell you, people ask me all the time, like, should I stay away from a carrot because it has carbs? No, right? A carrot is grown in this earth. It's got a lot of beta carotene. It's got a lot of nutrients. So how do we simplify this? And I bet if you looked at what you ate in a day, most Americans, 75% of it is not a single ingredient food. It's opened in a bag, right? And again, doesn't mean we can't have these things on occasion. I don't want us to live in extremes because that increases cortisol, which increases inflammation. But if you just start with one meal, one food, maybe you're like, hey, I'm going to start trying to get one big salad with lots of different plants and color and clean proteins. That is great, right? Anything that we do to just give our body the nutrients at once is going to start slowly calming the immune and inflammatory cascade. We're not healing any of this, again, through food. We're using it as a tool. We do talk about minimizing added sugar. So if you start to look, some people are very surprised. You go to buy a marinara, and you look at the ingredients. Marinara puts sugar in it, right? Why is my marinara 10 grams of sugar? I'm trying to eat, I'm doing some high fiber pasta with some good protein, and then I'm adding 10 grams of sugar from my marinara, right? Again, we use sugar in everything. So if you're at the store and you can just compare brands and find one that's a little lower in sugar, or be aware of, well, why buy a salad dressing with sugar? I'll just do olive oil and vinegar at home, right? These little changes over time make a big difference. I also really encourage, going back to the sleep, prioritize good sleep routines. This is one of the most important things. There is tons of great books about why sleep matters. So if you feel like you are Netflix binging and you need more of a reason why you should go to bed a little bit early, get one of these books, read about it. It is one of the best ways for our body to recover and heal. And I always talk about it's not just the quantity, it's also the quality. So I have a lot of patients that tell me, well, I'm in bed for 8 hours every night, but they're tossing and turning. They're waking up 4 times a night to go to the bathroom. That's not good sleep quality, right? So we want to wake up feeling refreshed. We want to go to bed around the same time. We want to wake up around the same time. We don't want to have, 3 a.m. one night, 10 p.m. the next, 2 a.m. the next day, right? We don't want a ton of variation because our body gets used to the circadian rhythm that we give it. And it starts to learn when to make melatonin to improve our sleep quality, when to make cortisol to get us out of bed and ready to take on the day. So if we're always throwing something new at our body, it doesn't really know how to function at its best, if that makes sense. And then I always talk about move your body in ways you enjoy. There is not a magic one single workout that all of us in this room need to do, but we all need to move, right? This is true when it comes to circulation, when it comes to inflammation, when it comes to our heart health, when it comes to our mood. I can't tell you how many times I've been in a bad mood, stressed with work, whatever's going on. I'm like, I'm going to go for a 10-minute walk. That 10-minute walk can lower stress responses, and we're going to talk about the walking when it comes to blood sugar as well. So just whatever it is that you like to do, how do we get a little bit more of it, right? Don't put too much pressure on yourself to do this new triathlon, right? I feel like people are always looking for that new challenge, the 30-day thing. Just start moving your body in ways that you like, and it starts to build. My favorite saying and what we live by at STAT is little by little, a little becomes a lot. And it's so true. Small, simple changes over time make a big difference. We also talk about optimizing nutrients. As I mentioned, the vitamin D, the omega-3s. We also monitor zinc and copper. It is very important in the healing process. And we monitor protein levels just to make sure, amino acids, because those are your building blocks for healing tissue. And so if we are in a protein deficiency, if we are lacking zinc, omega-3s, vitamin D, it's going to impact on a cellular level the inflammation in our body. And then I always talk about checking in with yourself on how you're feeling. I can't tell you how many times I've met with someone. I'm like, well, how's your energy when you wake up? And they're like, I don't really know. I never really thought about it. I'm tired. I hit snooze 3 times. I'm trying to get myself up. I'm going straight to the coffee maker. I think a lot of times we don't evaluate how we feel. Take some time in the morning, sit with yourself, and how did you sleep? How do you feel? How's your energy? How's your mood? Make whatever your quick little 4-point check is to be accountable. If you're starting to feel worn down, maybe don't go out on Friday night. Go to bed a little bit early. Give yourself some self-love, right? It's the awareness that leads to the change. If we're not aware of how we feel, it's very hard to make changes, right? So that's kind of what we talk about when it comes to inflammation. Do you guys have any questions about inflammation? because we're going to talk about blood sugar, and then, of course, we'll open it up. Yes?
Hi, so thank you so much for everything that you just said.
Oh.
I've been on a rabbit hole for like the last year in functional medicine and just understanding more of like how your body's ecosystem and how important like your microbiome is. Because I have taken so many like chest medications and had allergies to so many. Currently right now I'm on Suppurativa. I've taken, you name it, I've taken it. And so I was actually talking to Dr. Briscoe here. She's also a functional
Oh, cool.
medicine doctor, and we were talking about blood tests, and she's just talking about like inflammation markers and things like that. So I went on this rabbit hole, and I just told my PCP like, hey, can I get a CRP test done? And she's like, yeah, I'll put it in for you. And I went to lab work like 2 weeks ago, and I took it. And now my question is, now that I have the results, she's not gonna like explain it to me.
Right.
But how do I know if the CRP is only related to HS? Because currently I do have fibroids. I am getting them removed next week with surgery. But my CRP was so high when I went to the hospital last week. The lady's like, oh no, that's impossible. It can't be that number. And like you said, lab work, like the scanning, it says 1 to 10, but mine was 69. And I'm like, what's that? Like, 69 don't sound like off the charts right now. I don't feel like that's a good thing, but every doctor that I saw was just like, no, that's just like LabCorp got it wrong. I was like, no, they took the right blood. Like, they definitely got blood out of me, but I don't know what that means.
Well, an HS is a chronic inflammatory skin condition, right? So I would imagine a lot of people, when they go to get blood work, their CRP is going to be outside of that less than 1 range. I would imagine in my patients, when the CRP is that high, they're in a flare, like they're actively in a flare. And if that's the case, then that is going to elevate the CRP. But we're still striving to get that down, because that's what's going to also help you get out of the flare. And so it's normally multiple factorial, where you probably need, if your CRP is that high, to talk with the dermatologist, get some steroids, get some pharmaceuticals, but also looking at long-term. Because our thought process in this is we can't take steroids for the rest of our life, right? Like, it can lead to blood sugar elevation. It can start thinning the skin if we do too many of them, right? It can create sleep issues. It can create cortisol imbalances. It can create chronic fatigue after we've been on them for a long period of time. And so a lot of people come to us because they're like, I want to figure out any tool I can do as well to help with my body's healing as I'm working alongside the dermatologist, because I can feel the impact of this is my 8th antibiotic this year, right? I'm now dealing with vaginal yeast infections, and they gave me 1 diflucan, and my yeast is not gone, right? Yeast is very stubborn, and we see this a lot in HS populations because of antibiotics and blood sugar. Sugar feeds it, right? So how do we then work on balancing the microbiome and the yeast? So CRP is something that will fluctuate. It's a reactive marker, C-reactive protein, but I would encourage you to track it and get to know your CRPs. When you're feeling good, what is your CRP? When you're feeling in a flare, what is your CRP? And what are some of these things that we're going to talk about today that you can start implementing and see if you go from 69 to 45, it's like, okay, we're coming down, right? Can we keep an eye on it and watch that process? Because normally in my experience, CRP goes with flares and worsening skin conditions and all conditions, right? Thyroid levels get worse, all sorts of different things, joints feel worse. So I encourage tracking it. And I would say it's probably not a false. If they think it's a false CRP, check it again. It's dollars. A CRP is a very inexpensive test, which is why I wanted to bring it up. And most PCPs will be happy to draw that for you, which is great. Yes? Yeah. So in our experience, when it comes to massage, one of our favorites when it comes to inflammation is lymphatic work. So a lot of the massage work you're doing is helping with lymphatic system, which is really how our body clears things. And it's a very good recycling system. So as long as the patient doesn't feel like their symptoms are getting worse, we encourage lymphatic massage. And that's kind of in the same line of why do we care that you move, right? Rebound, walking, lymphatic massage. We need to circulate and we need to be clearing. and we need to be detoxing. So we would never hold anybody back from that, but I always say we're unique people. So if somebody's experience is, I felt worse after a massage, we're not ready for a massage yet, right? But cupping is great. It brings energy to the surface. Cupping is a little bit more, for us, we use it for muscle tightness, for pain. So it can really help in those areas, less about the lymphatic. So we suggest more of the lymphatic massage in the inflammatory conversation. Yes? Yeah.
And I'm a dialysis dietitian, and so in order to check patients' protein level, we just use albumin. What are you looking at?
Total protein. We just check a total protein in a CMP, but we also do look at albumin and globulin. We look at all of them to see. And high protein and low protein are also not good, right? High protein can be more of a liver issue, so we want to explore that. So some of our patients are like, I'm doing so great, my protein's at 8.9. I'm like, you're getting a little too high with your total protein. We might need to look at your liver, right? But we also have patients that are at 5.8 and not healing and building muscle, and that's too low. So in general, with total protein, we like it around 7. So don't want to be on either end. And that's in the CMP, which is a basic panel that's dollars again. You know, these are I wanted to bring as many tools that you guys might have already had these checked to just look at where you're at and not feel like you have to spend $5,000 on every stool test and micronutrient test and food sensitivity test. It's often not necessary if we're not doing some of the basic things, right? So the next area is blood sugar. And I put this as 3 key components of longevity. Blood sugar is one for every single person. We know when our blood sugar is high, it fuels inflammation and it impacts our wound healing. It impacts our gut microbiome, our yeast balance, all sorts of things. You guys have probably experienced feelings of blood sugar being all over the place, high or low, right? If we get into a hypoglycemic state, we start to feel tired. We might start to feel shaky. We might get hangry. When I was younger, I always remember my parents would be like, hey, do you need to go get something to eat? Like you could recognize on the outside when my blood sugar got low. So blood sugar balance is critical. As I mentioned, we don't want to live in low or high. There is a lot of ways to monitor blood sugar, but I talk a lot about this blood sugar continuum because we want to catch before we're diabetic, if we can. If you're caught and you're diabetic for the first time, let's do something about it, right? We can start working on it, but we try to catch early. So we do all this blood work on everybody. And the first thing we'll start to see is fasting glucose starts to become high. And to us, we have a really optimal narrow level when it comes to a fasting glucose. We want our patients in a fasted state to have a blood sugar between 70 and 85. If we're getting up to 99, they might not say anything yet. But when you're at 102, then they'll start to say, hey, your fasting glucose is a little high. So we try to be very proactive and catch these elevated fasting glucoses before it's a problem. So normally first thing you'll see is some slightly elevated or fully elevated fasting glucose. That is also in a basic CMP. You guys have probably had it run and can look at where your level is, but we want to have good fasting glucose so that we're making glucagon, which is a really important balance when it comes to metabolic health and inflammation. Sometimes you can have a high fasting glucose and a great A1C and a great insulin. And in those situations, sometimes it is a cortisol imbalance, a stress hormone. So if we're not sleeping well, if we're having hypoglycemic episodes as we sleep, our body will adapt to that. It will increase cortisol and it will increase our glucose. So fasting glucose is one of the first things. Adiponectin is the next thing that starts to dip down. We know a low adiponectin is correlated to all-cause mortality and heart disease, where the higher the adiponectin, the lower risk of all-cause mortality. So if we start to get low adiponectin, metabolically we're not functioning optimally, and inflammatory-wise we're going to see more inflammation. Then we start to see our insulin rise. And we like a fasted insulin really tight. People are always like, wow, in functional medicine, you guys obsess about insulin. And we really do. We like a really low optimal fasting insulin. And our perfect is under 7. The range lets you get to 25. So if you're going into a primary care and you get your fasting insulin and you're at 24, they might say you're in the fine range. But if you're fasted with an insulin at 24, most likely you're going to have insulin resistance, right? You're knocking on prediabetes and diabetics' door if you don't already with an insulin that high. So we look at that very, very closely. Then we start to see the A1C rise. We start to get into the pre-diabetic range. And an A1C, I always joke, is a diabetic's worst nightmare because a lot of our patients come in and they move their labs, because they went on vacation and they didn't eat well or they drank a lot and they don't want to come in and do their blood work. So they move it 2 weeks. And I remind them every time, I'm like, well, remember an A1C is a 3-month average, right? So you have to be doing something for a 3-month period for me to see it reflected in an A1C. So that is really a gold standard when it comes to blood sugar control because there's less variation because it's a 3-month average. So our red blood cells live 120 days and we're looking at the blood sugar control within those cells. So it's really a pretty cool, cheap test to look at. We also like a very tight A1C. So we like it to be 5.2, even though 5.7 is pre-diabetic and above 6.4 is diabetic. So a lot of our patients come in too and they tell me, well, they told me I was just pre-diabetic. They weren't worried about it. And I'm like, okay, well, to me, that's a yellow light, right? That's like a, hey, we need to slow down because we don't want to wait till we're diabetic and then act. And that's where functional medicine, we're always looking for prevention, longevity, disease management before we get to that red light and the diabetic diagnosis. So we use a lot of CGMs at Stat Wellness, which is continuous glucose monitors. If you were pre-diabetic or diabetic, usually insurance will cover it. If you're not, which we use it for people that are not all the time, insurance doesn't like to cover it, and it can be more in the $80, $150 range. But if you are and you've never worn a CGM, I highly suggest it because this is where you can see what's happening to your blood sugar during the day rather than just that insulin and the fasting glucose. And this is where we talk about the uniqueness of us, right? So even in the health food realm, like I know some of my patients, they don't respond well to rice. It doesn't matter what, if they have a protein and a veggie, rice always spikes their blood sugar 80 points, right? They go into the meal at 90, they finish their meal at 180. Rice and them just don't get along. Some people are that way with sweet potatoes. Rice and sweet potato are single ingredient foods, but how is our body and our gut microbiome responding? So blood sugar is critical. And we talk about a lot of different strategies. One of my favorite books that a lot of my patients I share with is The Glucose Revolution. I don't know if anybody in here has read the book, but she's the glucose goddess. And I like her stuff a lot because she's not black and white. You'll see her be like, hey, I went to go eat a chocolate cake. Here's what I did to balance my blood sugar with the cake, right? So you feel very relatable to her because nobody can eat 100% of the time perfect, right? And so if we're going to not be eating as well, what can we do to help balance our blood sugar to the best of our abilities to help, again, with our body healing and to help with inflammation? So we talk about very simple too, like whole foods. Look at a plate. How do we balance a plate for blood sugar? We love if you could get 50% of your plate to be vegetables. We like vegetables, we like color, we like the fiber in the vegetables, which we're going to talk about with the gut. And then we want 25% to be a good, clean protein. We probably know that the quality of the protein is just as good as the quality of the animals feeding and how they were taken care of. I also know it's a luxury to get meat from a local farmer, to be grass-fed, grass-finished. There's so many things in the animal product space that are complex for a consumer. So that might not be realistic for you. But if we can still build this balanced plate, it's going to make a big difference, even if we aren't able to get good grass-fed, organic, grain, all of that free animal product. And then we want 25% to be our carb. So that's like the sweet potatoes, the lentils, the rice, and then a good healthy fat, like an olive oil or avocado slices. So if you think about a plate, how can we get some more veggies, cleaner proteins? How can we get some good carbohydrates and a healthy fat? That's going to be very blood sugar balancing. Versus, let's say we start our day and we just grab, this is a very healthy food, right? But let's say we just grab a banana and run out the door. That banana is going to raise our blood sugar and impact how we feel the rest of the day. Most likely, if you eat just a banana for breakfast, you're going to be really hungry 3 hours later and you're going to make a poor decision because your blood sugar has dropped off. And so you want to reach for whatever is going to bring your blood sugar back up. So we're really big on protein, fiber, and healthy fats to stabilize us throughout the day. We don't want to be on this roller coaster. One of the really exciting studies that came out a couple years ago that we loved was they did a study with CGMs, and they found a 2-minute walk after meals was all you needed to lower your postprandial glucose, which is your post-meal blood sugar. So I tell people, maybe we're not ready to change our plate. Maybe we're not ready to impact what we're eating, but maybe after we eat lunch, we can go for a 5-minute walk. That walking has been shown to help lower our blood sugar. In 2 minutes, 5 minutes, we can all fit this in. It's a great stress relief. So we all love this study in functional medicine, and it's very in line with our little by little, little becomes a lot. We can fit in short little walks throughout the day. We also talk about what is the glycemic index of our food. And this gets a little bit more complex, but the less fiber in the grain, the more likely it is to spike your blood sugar and drop it. So when you're looking at a carb at the store, just see if it has any fiber in it. The more fiber it has, the better blood sugar balance you're gonna have. And we're gonna talk about that next when we get into the GI system. And then there's other certain things we can do. Strength training, instead of focusing on weight loss, I don't like to focus on weight loss, I like to focus on muscle building. When we build muscle, we improve our glycemic and our glucose control automatically. Muscle loves glucose, right? So when we exercise, when we strength train, we're gonna balance our blood sugar more effectively. So maybe switch the narrative of how do I become stronger? How do I build muscle? How do I go for more walks to help my mental health and my physical health and my blood sugar, right? How do I maybe go to bed a little bit earlier? Choose a whole food when I have an opportunity. Little by little, little becomes a lot. My last thing I want you guys to feel is overwhelmed and stressed of all the things you need to leave here doing today, right? Simple changes. If you heard one thing today where you're like, I really don't eat any vegetables. I'm gonna start eating some more vegetables. That is a win in my mind, okay? What in blood sugar space? Does anybody have any questions? Because we're going to talk about the gut as the third and final area. Yes? So the perfect is 12 hours if you can fit it in, but we take 8. But 12 hours is the ideal. Yep. Mm-hmm. Mm-hmm. Balance plates, walking, building muscle, watching the hidden sugar. You guys, if you have not paid attention to a label, you're going to be blown away. Like you'll grab a bar at the grocery store for breakfast and you're going to be like, it has 28 grams of sugar in it. You're going to be blown away. It's not just the sodas, right? It's other things. I think you had your hand up? Yes. Yeah.
So I did a test like 2 days. Okay. Thank you. So I used syrup, regular sugar-free syrup, which high corn fructose, that it's the devil according to some people, but it didn't spike my sugar as much as when I used pure maple syrup. Like, so I guess looking at like the gut or health when it comes to that, like the maple syrup, I was at like 170. And when I used the sugar, sugar-free, I was like at 100.
Yep.
And so, is it really the devil? Like,
so if you're doing it in moderation and very, very occasionally, I think you're fine either way. If it's something that you do regularly, we do not put it in like the anti-inflammatory food group. So like I would say, for example, if you're putting it on waffles, my approach to you would you be open to trying some almond butter and cinnamon instead of a syrup? If maple syrup spikes you and your option is high fructose corn syrup, would you do some almond butter and cinnamon or peanut butter and cinnamon? And normally that's gonna be a lot more blood sugar balancing. But if you're like, Kristin, I only have this once a month, I'm like, okay, well, enjoy it.
all
Right?
perfect.
So hopefully that's helpful.
Yeah, definitely. And then, so the CGM is like a monitor that helps monitor your glucose. So I just recently requested, like this week, Dexicon, because I saw a commercial for it from my doctor. Like, would you say that is like the CGM is better? Like, I mean, I literally never heard of Dexicon before the commercial.
So if you were also with the maple syrup and the high fructose corn syrup doing a finger prick, I'd be interested to see what happens longer after it. So that's why we love CGMs, because we want to see your blood sugar at 1 hour, at 2 hours, immediately after. We want to see what's happening with your blood sugar while you're sleeping. And so if anybody out there has a CGM, we have very different optimals. You know, the range is 70 to 180, and they're okay with everything in between. We have, again, a narrower window. So we want, as you wear your CGM, fasting glucose 70 to 85. Before we eat a meal, we like it around 90. And we don't want what we eat to bring our blood sugar up much more than 40 points. We like rolling hills during the day. Of course, you're going to have occasional spikes, but in America, we're spiking, dropping, snapping at someone, reaching for a Snickers because we got to get our blood sugar back up. We're exhausted, right? If you ever have felt that, like 3 p.m., I need to put my head on the table from lunch, like my team knows, like, do not bring me a sub sandwich because I'll sleep. Like, I don't feel good. I can't keep seeing the patients the rest of the day. I need a lower carb, high veggie, high protein lunch, and my energy is so stable. But I like nerd out on CGMs and blood sugar. I wear them 4 times a year to just see how my body's changing, especially with pregnancy and nursing, and it's all different. Like, our bodies change and adapt. Our body composition changes. That changes our blood sugar. So it's fascinating. I'm so happy you're going to wear a CGM. I think you'll like the experience. Don't obsess about it, though, also. I mean, there was, right there. Oh, here.
I had a question about the CGM and then a comment. Can we buy one on our own? My doctor, like I'm no longer taking insulin. So it's like these points that I have to hit in order to qualify for one, so I can't get one. Can I buy one?
So CGM is a prescription. Like, you're supposed to have a prescription to get it. There are companies like Levels and NutriSense that do subscriptions. The problem is they're just much more expensive. And they're also an ongoing commitment, where for me, I have people wear it for 2 weeks and then take a break from it, right? And then wear it for 2 weeks, unless, of course, you're insulin dependent. I would suggest wearing one all the time. But yes, you may be able to find them online. We sell them. Like, we just do calls to make sure an appropriate fit, and they're $150, but we want to make sure you have the tools and that you're a fit for it, and you don't want to just buy one, not know what to do with the information. So, for example, I had a patient that it got in a capillary, and it was not functioning right, and their blood sugar was 45. They felt 100% fine, right? But their blood sugar is 45. They started chugging orange juice, eating cake. It wasn't moving up. They panicked. They went to the emergency room. They got an expensive bill. And I'm like, whoa. If you're feeling okay, we don't need to overreact. Like, we're using this as a tool. Nothing that we're talking about is like everybody should make a decision based on this. We're gauging what's going on. But yeah, you can. It's just, it might be a little bit harder.
Okay. So over the last 4 years, I started vegetarian because of the pandemic. I'm on all these medications. If I catch COVID, I'm gonna die.
Yeah.
So I need to get better. So I eventually ended up whole food, plant-based most of the time, vegan all the time. I've lost over 50 pounds.
Wow.
All these things that I'm doing, thank you. And my fasting is still high. I can wake up, it's 180, all these things, and I can get it down to maybe 140. But now, so they took me off the insulin, so I was happy about that. But I'm like, what else can I do? I know it's a big what if. I'm like, I'm doing everything. I move, I do Pilates, yoga, strength. I do everything to me. Yeah. And I'm like, how is it still high, and why am I not? I'm better, but I want to be even better.
Well, a couple things I think with that is, one, you may need more protein than you're getting, depending, and this is very individualized, so I don't like to I don't know everything about your history, but you may need a little bit more protein to balance the blood sugar, because that's one of the things when we look at a plant-based diet. Even beans is a carbohydrate and a protein. A vegetable is a carbohydrate and a fiber. A fruit is a carbohydrate and a fiber. So like, you could build a plate of 7 different carbohydrates that are just going to increase your blood sugar versus balancing it with some salmon, right? But we work with a lot of people that are vegan, and there's lots of ways to do it. You just have to be a little bit more intentional to get the protein to balance the carbs, which is a very intricate, I would suggest having somebody to work with on that. The other thing that we talk about a lot is this type 1.5 diabetes. So you've been able to come off insulin, but there may be a large inflammatory component to how your pancreas is making insulin and able to lower your glucose. So you may need to continue to work on the blood sugar, but we might need to turn gears and work on the inflammation. So that would be the other thing I would look at, because a lot of people, they are doing all that they can for blood sugar and their pancreas is just not making enough insulin.
Okay, thank you.
Absolutely, and I think there was one more back here, 2 more back here, and then we'll move on to the last section because we got 10 minutes left.
This is just a comment, a suggestion as a nutritionist who's worked with a lot of patients over the years, not with HS per se, but in talking about the single ingredient foods, those obviously don't have nutrition facts labels on them. So when you look at the nutrition facts label and you're trying to look at the sugar, what's really helpful for folks, I'm finding, and I think it will resonate with your messaging, is look under carbohydrates, but then see where it says sugars, and look to see if it says added sugars. Because sugars by themselves are not bad, particularly if it's natural to the food, like even carrots have sugar in them. But again, a carrot is not going to have a nutrition facts label. So if you're looking at a multi-ingredient food and you're looking at the nutrition facts label and you look under sugars, look to see if it has added sugars, which literally means they've added sugar. That item you might want to consider putting down.
Yes, and that is a very simple, tangible tip for all of us.
So I was just wondering, when I do get these sugar cravings, what is the best way to get that without going overboard? Because I feel like maybe I can get a sugar-free something, but maybe it has those artificial sugars. I don't understand if the artificial sugars are worse than real sugars, or how do I balance that?
So we always look at why are you having the sugar cravings in the first place? And it's normally one of three things. It's usually either fatigue. Have you not slept well? Are you stressed? Did you skip a meal? Why could we be fatigued? Because when we eat sugar, it gives us energy. So when we crave sugar, we might be seeking energy to make it through our day. That's where I mentioned the 3 o'clock, I need a Snickers bar, right? It can be a fatigue. It can also be a serotonin imbalance. Sugar gives us a temporary euphoria. They saw this when they looked at the brain as we consumed sugar. The dopamine area lit up. It's a reward. Our brain loves it. And it's highly, highly addictive. I don't think we really talk about how addictive sugar is. I always joke that we're going to create a Sugar Anonymous group at Stat Wellness for everybody to come in and talk about their sugar addictions and feel heard, because it's a hard thing to break. So it could be a serotonin neurotransmitter kind of effect and a habit. You just want to keep having that hit of your sugar. The other thing that I know is a more non-traditional look, but we do see a lot of yeast imbalances, and yeast sugar lifeline is sugar. And so if we have a lot of yeast in our system, we want more sugar because it's thriving. It thrives on that. So it can kind of hijack our taste cravings and what we want. So we always look at yeast balance, gut microbiome. We look at neurotransmitter mood when it comes to sugar cravings, energy, and low blood sugar. So we want to understand the root cause. That doesn't mean sugar cravings don't happen. So one of the things that helps with sugar cravings, cinnamon is actually really helpful. So if you're really craving something sweet, if you could do a cinnamon tea or do something with some peanut butter and cinnamon, as I mentioned, it curbs sweet tooth. So that's really helpful. Going outside for a walk, sometimes just moving your body will get rid of the sugar cravings. Sometimes a healthy fat will exchange that need for sugar, walnuts, for example. So there's lots of ways. The more you don't eat sugar, the less you crave sugar. So it is one of those things that's the hardest habit to break. But I know I'm not a sweet person, but I believe I'm not a sweet person because I don't eat much sweets. If I have something for someone, they're like, that's not sweet at all. For me and my taste buds, it's incredibly sweet. I just want one bite and I'm good. But it takes a long time to get there because our body is not used. In America, we don't love bitter flavors. A lot of things are not bitter. They're sweet, right? Marinara, we add sugar to. Bars, we add sugar to. Cereal, we add sugar to. Syrups, we add to our coffee, right? Everything we add sugar because that's what we like. So a company doesn't want to come out with something that has no sweet taste. What American's going to buy it? How am I going to make it, right? So then they start adding the artificial sweeteners. I love electrolytes. All the electrolytes, they put stevia or monk fruit or these things in them. And while maybe monk fruit and stevia is not bad for our inflammatory cascade, those are probably some of the better artificial sweeteners, they're still sweet, and they're 8 times sweeter than sugar. So we're going to want more sweet, right? So if we're eating a lot of artificial sweeteners, we crave more sweet taste, which is what's fueling a lot of these sugar cravings, if that makes sense. Great question.
Thank you.
So the last topic that we have just about 5 minutes to get into, which is really important, is our gut. And we talk about, Hippocrates said over 2,000 years ago, our gut is the gateway to our health. And that intestinal barrier is our first line of defense when it comes to infection. So our gut is really helpful for our immune system, or it could be thriving, causing more of an immune and inflammatory. So it's either helping us or hurting us when it comes to our gut lining and microbiome. And our microbiome is really influenced even at birth. So this is what's really interesting. There's been a lot of studies about vertical transfer and the gut microbiome. So I always tell people, if you're vaginal delivery, you get all of that bacteria from the vaginal canal. That's our first place that our gut microbiome gets bacteria. A lot of people need to be born as a C-section. You can also get it from skin to skin, from breast milk. So maybe you were a C-section, but you were breastfed. You get more microbiome organisms from breast milk than you would through the delivery when you're a C-section baby. So the research studies show there's lots of ways to get the good bacteria, but we know a lot of it is influenced at birth. And then our environment plays a big role. So what's interesting is, as they were talking about in the last presentation, the sterileness, right? So hand sanitizers, wiping counters down, using antimicrobial everything, strict cleaning products. We have become a little bit too sterile, and we want the bacteria in our gut. So there's some studies that people that have dogs that live in the home have less seasonal allergies. And part of the thought process between that is the dogs bring in a whole slew of different bacteria, right? And shifts our gut microbiome, which shifts our immune system and how we respond to our environment. So we look at the gut microbiome when it comes to allergies, when it comes to autoimmune, when it comes to inflammation. And one of the things we talk about a lot at our practice is the Bristol stool chart. Have you guys ever looked at your poop? We talk about it a lot. Is it snake-like? Is it a 4 on the Bristol stool chart? Is it diarrhea? Are you going every third day? I remember when I was in school, they asked, assess your patient's normal bowel habits. If nothing has changed, that's okay. And I started finding, my patients are going every third day to the bathroom, having a bowel movement. That's not okay. That's not optimal. It may be common, but it's not optimal. We should have a bowel movement every day, right? It's how our body detoxes. It's how we eliminate. It's a sign that our gut is working. So I would encourage you guys to start paying attention to your poop, start thinking about how your gut feels, because it impacts so many of these things, from our mood to our immune system. There are some key components that we need to think about when it comes to our gut microbiome. And you might see prebiotic, probiotic, and postbiotic and think I'm going to talk about a bunch of supplements, but I'm not. This is a very important process that happens through food. So prebiotics, have you guys all heard of prebiotics? So this I think of as fertilizer for the good bacteria in our gut. Prebiotics are fiber. This is why we care so much about fiber, is our gut microbiome. So one of the big things they looked at between a vegan diet and a keto diet was the gut was one of the most influenced areas between those two diets. And what's lacking in a keto diet typically is fiber to feed the good bacteria in our gut. So how do we protect our bacteria? High fiber. So we need fiber and prebiotics. That is going to feed the good bacteria in our gut, and that creates what's called a postbiotic, which is a gas that helps heal our gut lining. Postbiotics are like the fuel for our colonocytes, which are the cells that line our intestines. So when you think of prebiotics, probiotics, and postbiotics, the number one thing you can do is try to get 30 grams of fiber a day, and that's a lot. I break it down to 10 grams per meal. The standard American gets about 10 grams of fiber a day. So if you're at 10 grams, don't jump to 30 or you'll have a lot of bloating and discomfort. Gradually increase fiber. And we want it from whole foods. Raspberry is a super high fiber food. Lentils, super high fiber food. Avocado is a prebiotic and a fiber food. I said lentils and beans, right? Cruciferous vegetables, that's another great fiber. Ground flaxseed, chia seeds. These are things that we can get that are really, really high fiber. We also talk about our gut lining. So this is where we want to be aware of inflammatory foods for us that might weaken that barrier that we have. So how much sugar are we getting? How much processed food are we getting? Maybe we do find a PCP that will run a gluten and a dairy sensitivity to see if we need to be aware of any of those. Maybe we just simplify and start eating whole foods. That's going to protect our gut barrier. A lot of people in our space talk about drinking bone broth. You guys might have heard of this. The theory behind that is the intestinal permeability. It's rich in what's called glutamine. Glutamine is our most abundant amino acid that heals the gut lining. There's a lot of studies on glutamine and secretory IgA, which is our immune system in our gut. So we want to keep that barrier really strong. And then the vagus nerve is critical. And vagus nerve dysfunction is absolutely on the rise in the United States because there's so much stress on us at all times. There's so much technology. There's so much noise. Our vagus nerve doesn't get a lot of time to relax, to calm, and to recover. So I always look at stress as being a key component to gut health. So eat fiber, 30 grams of fiber, focus on whole foods whenever possible, maybe incorporate in some slow simmered bone broth, maybe talk with your PCP about some glutamine, which is just an amino acid, and make sure you have the good organisms that you need in your gut, which maybe you have the luxury of doing a microbiome test, maybe not. Starting with fiber is going to make a huge difference. And that is all that I had. I know I had to go through the GI a little bit faster, but my sign says to wrap up. If you guys like any of this messaging, I also have a podcast that is obviously a free resource, so you can listen to the Little By podcast. There's a lot on these topics, so if you want more information in the functional medicine space, you're welcome to go there. You can check out our Business Wellness, my personal page as well. And I really appreciate you guys having me here. I could talk about this stuff all day long, but just know we can't control the disease, but we can control our immune system, our inflammatory cascade to a hair, right? And if we make a hair of improvement, that's a hair of improvement, right? So hopefully you guys feel empowered to make some small, simple changes that are going to make a big difference over time.